Awesome. Well, I am so excited to be here. I'm Michael Mann, the host, Planetary Health First, Mars Next. And I got Patty here, and she is no stranger to healthcare. We're going to have a great talk. She's with Talkdesk, and they're not just in healthcare, man. They do everything with call centers from retail, financial, and healthcare. And so we all know that healthcare is a little messy, a little complicated. So I'm really super excited that you're here because you are part of that huge area that could be really solved much better, that experience. So Patty, you want to just quickly introduce yourself before we get going?
Michael, first, thanks for having me. Great to be here. I'm the general manager of healthcare for Talkdesk. Talkdesk is a contact center as a service provider, with the first one that's natively born in the cloud. Been around for about 13 years. Me personally, I've been in healthcare for 25 years, working with organizations such as Aetna, McKesson, a lot of different groups around in population health and pharmacy as well. So no stranger to the healthcare world. Been working with life sciences payers, et cetera, for a lot of years, and really working on how do we automate manual processes. So that's kind of where I come from my background.
Yeah, God, you are no stranger to healthcare. You don't have to give your age here too either. We won't do that. But
well, anyway, I started when I was 10, so that's
Yeah, all right. So you're what? I guess then you're 28. Let's just say you're 27. All right. Well, let's start with this blog. You wrote a blog, and there was, from your personal experience, recently you've written it, and I guess there was some reference to probably a doctor we've probably heard of, Dr. Sachi Jain. I think we've heard of him before. So help fill us in before we get going.
So I think the premise for this was Dr. Jain kind of sounded an alarm about, contact centers really being a danger to healthcare, which I sort of had a visceral reaction to because that wasn't my experience. I had a very different experience over many different encounters, but specifically the one that I talk about in my blog with my mother. So my mom had many chronic diseases. And so, as you can imagine, coordinating her care was not an easy thing. So we spent a lot of time at a lot of different specialists. One of her comorbidities was diabetes. And she had some pain, really bad pain in her hip, and was unable to be mobile for a while. So they gave her a cortisone shot to sort of help that. One of the side effects is increased blood sugar. Now, obviously, that's really dangerous for a diabetic. So they knew it was coming, gave her some sliding scale insulin to make sure that we understood how to take care of her. Couldn't get the blood sugar under control. Her primary care doc pointed back to her endocrinologist, who we tried to get a hold of every day for a week. Meanwhile, my mom's blood sugar wasn't stabilizing. We called and called and called, and no one ever got back to us. They didn't answer the phone. They didn't call back, even though we left sort of, hey, here's exactly what's happening. Our blood sugar's at 500. That's really high. We need to make sure that we can come in and recalibrate what's happening. And just never even got a call back with a, hey, maybe you should go to the ER or whatever. So my mom ended up in the ICU for 5 days as part of this event. And it definitely shortened her life because the amount of blood sugar being that high for that long is not, it starts to shut down your organs, which was why she was in the ICU for so long. So not only did we have, unnecessary cost to the system, but trauma to the family, trauma to my mom, her body, et cetera. And so when I think about, hey, that, doctor's office with those folks that can just, squeeze you in as needed, I just have never experienced that as part of, my healthcare journey, my parents' healthcare journeys, et cetera. And these are places that are still answering the phone in the office. They have not gone to a centralized contact center. And I look at the complexity that we've built into healthcare with all the administrative burdens coming from the reimbursers. So the payers, CMS, et cetera, have really put in a ton of different metrics that need to be reported on and different things that they need to do. So the doctors are really, they're ending up selling their individual practices to larger practices so that they can go back to practicing medicine, right? Because the administrative burdens are so high. So I had that visceral reaction of like, wow, I don't think you can put this experience onto contact centers, right? And he does say some things that I completely agree with. One is, outsourcing to India or the Philippines or going overseas is, I think, a definite issue, right? Especially for these highly complex issues. I think it's going to be difficult to maintain part of the care team if you're outsourced and you're not part of your organization. So completely on board with those sorts of things. But, when I came here, when I first was talking to Talkdesk about coming here, I was like, why would I want to go into contact center, right? Like, no one has contact center. And then I started to think, when you think about the experience that you have today and you think about calling your doctor, I can tell you I've been with my primary care doc for 21 years. And every time I call, it's like I'm brand new. They don't have context on me. They don't know who I am. They don't know my journey. They're certainly not guiding me. And I thought, there's a better way. I think we can build something different and unique here. From the perspective of people who understand healthcare, who work in conjunction with health systems, as well as strategic partnerships with EHRs. So we are a strategic partner with Epic and are in what they call their workshops. So we're co-innovating to look at, there is a better way. We have a lot of information on patients. We understand their journey. We should be able to have those conversations and serve up information to those contact center agents so that they're not trying to dig through, or worse yet, they're just not, because they're just going to answer the question. They're not going to be an active part of the care team. They're just there to answer the question that you ask. So that was really the premise, is how do we make healthcare more personalized from the perspective of when you call, because there is nothing more personal than healthcare to us.
Yeah, I feel like, right now there's so many layers and so many outsourcing and so many people involved in healthcare. And whether it be a med device company, like we had a discharge in the family and we got a call from some random company that they want to do whatever, RPM company. And so I feel like that conversation, Dr. Sachin Jain, I'm sure it's, genuine, but it's also, it's also, there's a lot of nuance there. And yes, call centers, I would imagine, geez, like, let's make healthcare better. There's so much, maybe it's a concern that too much party involvement, like you guys could do a lot of the care, I imagine. And that's what you're realizing, probably a big opportunity. But kind of getting into our conversation today, it's probably where we are with like that tension today between that automation that you guys are and versus that personalization. So how do we kind of get to that point where you guys are really accelerating, adding value? Tell me that point. I think that's really a great discussion.
Yeah. So I think that there's a fundamental step back to do, which is, let's think about central tenets of healthcare, right? So it's not customer experience. It's clinical care, right? So clinical care, if you think about how health systems measure themselves about success, and even from a patient experience perspective, it's how did we treat you when you were inside the four walls of our institutions, whether it's the physician office or the healthcare system, the hospitals, et cetera, acute care setting. That's really what they measure, right? Because it's really all about excellent clinical care and how can we deliver that and what can we do better. There's very little focus actually on prior to entering that. So either digitally or by voice, how is that entrance into that healthcare system going? And many are starting down that journey, but it's just starting. So it's not the same as if you look at other organizations like retail, whose entire world is around consumer experience, right? They think very differently about it. Mm-hmm. The nice thing is being able to be in a company that focuses on retail and financial services. Financial services have been doing automation for years. When was the last time you went inside the four walls of a bank?
So are you guys working I know you can't tell me, but I'm imagining maybe Fidelity or Vanguard or
we've
one of
those. A lot of credit unions, banks, things like that, who have already been automating different things and are looking to further augment or change the way their experience are going, both from a digital perspective as well as from a voice perspective, so that they're getting as much self-service and convenience as possible, but at the same time, security, which is really important. We have similar regulatory requirements here in healthcare around authentication and making sure that you don't give information out to the wrong parties. So all of those things are really at the core, but they sort of made me think about how do we really change just how we think about contact centers. So today, as we think about contact centers, it's really ask answer, right? You call in, you ask a question, hopefully you get an answer, and then you're done, right? There's not this opportunity to really turn the contact center into part of the care team, which I think we can do. There's so much more information now, us being integrated fully inside of Epic, being able to grab that patient's information and authenticate them before they even get to an agent, and really do a lot of self-service and off shooting some of these easy things out. So I want to understand my balance and pay a bill. I want to get a prescription refill. I want to make a primary care appointment or some more simple appointment. Some you have to go to an agent because of the complexity of those appointments and the things needed. But there's a lot of things we can automate, take off the plate of those agents, give them back time so that they can start being guides for these patients who are calling in. If you've been diagnosed with something.
I feel like if I was a patient, I would way more rather deal with you guys. I mean, just the experience that I've had just recently this week, my daughter's sick, and we called the first 8 o'clock in the morning. We couldn't get anyone. And then we had to take her to urgent care because of that. And then my wife, she's still coughing. So we followed up today, and it's just still calling at 8, 20 some minutes. Of course, this is a system down, but there's issues even when the system's down. And so what I feel like at this point in time, the hospitals, the systems that don't wake up to this, they're going to lose their shirt. I mean, you guys are offering what people, this is like, we're not expecting rocket science. It's just, this is the way the world works now.
Yeah, for sure. And I think with these large language models, they're developing so fast, the ability to have these experiences that actually feel like you're talking to a human, the voices now and the ability to be more conversational are so much easier. So it's really going to take a lot of the burden off of those agents so that we can train them to be more advanced and to deal with those complex patients like my mom, right? Who need more guidance. We have created such a difficult system to get through. And we've created no guidance. It's all on the patients to figure out how to get through things. I had an experience my brother was telling me about where, he's also a diabetic, and he had his endocrinologist cancel an appointment. And, he got busy and didn't call him back. So, it took a little bit. He calls back and they said, oh, well, we need a new referral. He's like, I've been a patient there for 10 years. What do you mean? I need a new referral. And they're like, well, we need a new referral. So, he had to go back and forth, and it was just crazy. And then when he called back to make the appointment, he said, okay, we're going to see you on Monday. And he said, okay, that's great, but don't I need to get my labs first? Because the entire reason
exactly
is to get labs so that you can discuss them. They're like, oh, that's get labs first. So it's like, so you're going to have me come in, and then I'm not going to be able to have a real conversation because you don't have the labs. You're going to send me off to get labs, and then I have to come back. And now you get 2 visits versus 1.
Yeah. And this is like every day. This happens to me too. And then they're like, and when I had my last lab, I could not believe it. They could not do my cholesterol screening. They said that they didn't have I still don't believe that. The person, that's that. I mean, sometimes you get, and it's like, did you forget to put the order in? Or are you trying to tell me that? I mean, this is like, that's like you go to a hospital and but this is stuff that you hear anecdotally. Yeah. And so anyway, but
a lot of complexity inherently in the system.
So for this, like, you guys really, I think, the call center is, you guys, so tell me, like, what makes you guys different? How do you work with providers and health systems to get this right, that those that are open to this?
Great question, Michael. So I think that there's a couple things. First, I think being really working with the EHR vendors is a must, right? Because when you think about being able to guide, being able to make people feel like you understand what they're going through and all of those things, it's going to require the information that's resident in those systems, right? Those are the systems of record for health systems. So, well, number one is you need to make sure you're working with those vendors. We have a special relationship, like I said, so we're actually really thinking about this strategically, having the population health background that I have and all of the different understandings of like, let's just take technology off the table. What should this actually feel like?
Mm-hmm.
And then going, so starting with the core tenet of, we want the call centers to be part of the care team. They should be a key piece of guiding. So in order to do that, what do we need to do, right? We need to be able to present information in real time to those agents based on listening to the conversations that are happening, right? So we understand you're calling in about X. We know now that, okay, you're calling in for a prescription refill. I'm out of refills. I can't get my medications. Well, there's probably 100 reasons why that's the case. You probably haven't been in to get your annual physical and your labs and all the things we just talked about. So we need to make sure we're getting you those gaps in care filled. We want to make sure that not only are we answering that question, which is, I want a prescription refill, so I'm going to go to the doc and I'm going to make sure you have your meds, but I want to make sure that we also get you a, prescription that's good for the next 12 months. Maybe we can also mail you your medications so that you don't have to think about them because we have a retail pharmacy. We have the ability to make sure that all the gaps in care are checked. That helps us as a physician organization hit our HEDIS measures so that we get our bonus payments and we're not now getting hit with penalties for not doing the things we need to do. And there's a possible revenue stream of, we can mail order your maintenance prescriptions right to your house. And so you have revenue there. So we've been able to sort of turn that from being, I'm writing a note to the doc to give you an extra month of prescriptions, but I'm also now filling all my gaps in care, making sure that patient is okay, because in order to really catch anything early, we want to make sure we do all these screenings, right? That's how you can tell if someone's going the right direction with their chronic disease and or not, so that we can adjust.
So Patty, when you guys work, do you do everyone's like, is it PPM, like a monthly per patient? How is it just a service fee? Because it seems like you're talking about some value-based care models with your providers. How do you do it? And you don't have to share that if that's like none of our business.
No, I mean, it's a subscription model. So there's that, and usage for AI. I think we're all pretty similar as far as how we price. But there's a lot of upside, I think, that people aren't thinking about contact centers for, because they really, if you talk to people, how can I just not have agents? I just want to get out.
So what I'm kind of hearing, if I was a smart health system or a smart payer, or smart provider, I would be starting to see, well, hey, how are we going to actualize this and monetize these VBCs, this value-based care, and really execute it? And maybe actually working with someone like you might help. I'm just thinking that because you guys are checking off all those boxes and actually getting those done. So to me,
and I do think that, I think it's important to work with someone who understands the system as opposed to just understands, contact centers. I think it's important to have both. We've got both. So that's good, because you do have to, the thing that I think that's really important to remember is it's not just about implementing technology. You've got to look at your culture, your people, and your processes, and how do we pull those together to optimize what we're trying to accomplish. And that's not a quick and easy journey.
Well, this kind of comes to where we are, right on the freeway, right where we're meeting at that stop at the halfway point, or not halfway, but close. It's really about how are you going to integrate with the care teams, like providing that. So let's get to that. I know that's part of this conversation.
Yeah, I think that first of all, like I said, the integration into the EHR is so important, and being able to really understand what's happening on those calls. So having AI, there's a couple of things you need to do. One is you need to automate the easy things so that you have time to do these more complicated discussions, because those you're all of a sudden going to go from having something that's a fast, quick conversation to something that's longer, because you're guiding and you're getting people to do the things that they need to do for their health. So you need to be able to offload the things that are easier. And then as you're starting to sort of be more of a healthcare guide, as opposed to just a contact center agent, you need to be able to understand what's happening. And AI can do a lot of that. We understand what's going on with the patient. There's a lot of educational material that these guys have to sort of sort through today. I sat with agents. They literally have sticky notes all over their screens, as well as very complicated Google Sheets or Excel documents with, this is what I need to do. That all can be automated and be able to come up in real time as an agent is speaking to a patient, right? Okay, here's your actionable next steps that you should be talking about now based on this conversation, things like that, to allow these guys to have better conversations that are more meaningful and have better outcomes for the patients as well as the health system. So it's a win-win.
I feel so bad. I was thinking of you. You guys are Talkdesk, and I put Help Desk because all I think in my mind is you're helping. You're helping. So
I love that.
I tell you, I hope there's no other competitor out there that's called that, but I'm not going to use that. It's Talkdesk is the name of their company and the organization. But all I hear is that you're not just talking; you're actually making stuff happen. With that,
Yeah.
And really, I'm hearing like this is the stuff that that the care teams, the integration, it's not happening. You're making it happen in healthcare.
Yeah,
That's a sad reality. Maybe some are doing it, but mostly this is not universal. Like let's just say 5% of healthcare, maybe there's somewhere in some oasis it's happening, but not universal.
Correct. That is definitely correct.
So what, like, can you get more into this AI? Everyone's talking about this AI. Is it real? Come on, like AI. Come on, let's talk about it.
I know it's the buzzword. We were joking. We were at a customer site doing a quarterly business review, and there was the joke of, okay, we're not going to take a shot every time someone says AI, but it feels like it's a drinking game these days because everybody says AI in every piece of their discussions. But, we've been working with AI since 2018. We made a fundamental decision that this was a really important evolution. So AI isn't new. What's new is these large language models that are able to learn and to really democratize AI, because it used to be you had to really program every little bit of those bots that you talk to with if-then statements. If someone says this, then say this. If someone says this, then say that. The large language models are really democratizing AI. They're allowing folks who don't have data scientists on board to really start adopting these things because you can actually program them by saying, okay, I want to have you point to this knowledge base, right? So you point to your knowledge base of these are the things that we want you, best practices of how we want you to handle appointment scheduling. We can point to that, the AI consumes it, and then you can ask questions of it and it will grab from that, just from that, because we put constraints around it so it doesn't start making things up. And then it will say the answers for you, or it will pop them on the screen to the agent so that the agent can have those conversations, depending on how you want to do it. I think healthcare is very concerned about putting too many virtual agents out there. And I think it's really interesting because it depends. Is it a children's hospital where you're dealing with younger audience? Because typically the caregivers are, the parents. And then there's more of the standard acute hospitals, which tend to have a lot more interaction with seniors. And so they're a little more concerned about putting the AI up there, if patient facing or family facing. So what we've been doing is making sure that we work with these organizations to step them through. Here's the things we can do. Routing is really easy. I mean, just think about, you call a health system, trying to get to the right person to answer your questions, a big chore.
Good luck.
So how do we get you to the right person to begin with so you don't have to be transferred 20 times? And then how do we coach those agents so that they get the information to you in the most prescribed manner possible and can help you guide? So those are kind of core tenets. And again, I think being able to automate so many things and being more compliant, right? You think about paying your bill, you want to be what we call PCI compliant, right? Which is safeguarding your credit card information and all of that stuff so that it's not being exposed to the agent. All of those things are really important. There's a lot of regulatory requirements inside of healthcare that we need to make sure we're doing and making sure that we're HIPAA compliant and all of those different aspects. It's complex for sure, but there is definitely a better way to do this and to do this now. And so, it's going to get better and better and better. And these experiences are going to get easier as the knowledge bases get trained and written appropriately for the AI. There's a lot. I mean,
what are you excited about with 2025? I mean, like some real user case scenarios.
It is. It's really funny. So I was sitting there, and I won't tell you the customer that I was talking to, but it was in pharma actually, and it was about helping guide patients around their drug, right? Calling in, understanding different things. We took some of their information that's generally available on their website and had them have a conversation with our agentic AI, which is the ability to actually have a conversation. You can do things like change language in the middle and it changes with you. There's so many really cool things. And especially if you think about a lot of our folks that are in larger metropolitan areas where they have all these different languages, it's really hard for them to service those patients that don't speak English or Spanish, right? You typically have English and Spanish speaking agents, but outside of that, it's really hard. So being able to switch languages like that on the fly, being able to have conversations, give information, I think there's just some really, really cool things. And I'm super excited for the continued partnership that we have with Epic. We've got some really cool things that are coming in the next couple of months that we're going to be announcing. And, again, I think how when you start to, it takes a while to kind of get footing in healthcare. We're really starting to roll and we're starting to see just some amazing movement in the space. People are really thinking differently. They're more open-minded to adopting a lot of this technology, whereas previously it was really hard. And I think getting those executive alignment meetings and having those discussions are great. And we're working with payers, life sciences, health systems, providers. All of those things are really, really important. And I'm just super excited for how this technology is rolling out.
Yeah, I am definitely, like for instance, great example, I had a new camera. I'm not sure how the settings, YouTube's are not the efficient way. It's Chat GPT that is able to give me pinpoint like through that, even though some of it's crap, of course, but wow, I was able to find exactly, hey, I'm having issues with this on this camera and this is it. I need to know, where do I find. There's no way with the search engine optimization and with all the, they don't want you to find that so easily on a YouTube or, that's not part of it.
They watch all the different videos so that they can get hits.
Exactly. So I'm excited because when I'm hearing what you're really part of what, like, where this healthcare system is failing. And I see so much, with the fact that you're integrated, you're already in Epic, you're able to pull that data in real time. You're able to validate that. And then I'm sure at different levels, you might engage a nurse or a clinician depending on what's necessary.
Well, we have a lot of nurse advice lines where people are calling in, like you talked about for your daughter, people being able to, hey, where should I go? Right. There isn't an appointment available this morning, but it's urgent enough. I'm going to direct you to my urgent care. Right. Or if it's more acute, hey, look, you should probably take her to the emergency room. They can help guide you through the different levels of care that you need to access right away. And to make sure that, things are correct for you guys and you understand what you're dealing with. Because I think for me, more knowledge reduces kind of my anxiety level and my fear level, because you end up going, okay, I know what to do next. I'm going to go down this path. That's a lot of what we don't have readily available necessarily from health systems to help us to really navigate that system. Because typically if you have an event, a healthcare event, and you have to go to the hospital, when you get discharged, here's your instructions, Miss Patient, you've got to go do them all. Right? Nobody's being proactive. And really the thing that I'm really excited for is turning that around and making it more proactive, right? So you get home and the next day you're getting a call that says, hey, we know you need to schedule a follow-up with your physician. We know we need to get you in the next 7 days to make sure we prevent a readmission for the same thing. I'm gonna make sure I prioritize your appointment. Here's 3 or 4 options for you to come in. Oh, you don't have someone to take you? Let me make sure that I get a ride scheduled for you. We have a ride program to help our seniors get to their appointments when they don't have family members that can take them and things like that. So there's a lot of opportunity to be more proactive with these things, because today we're not. We try, but we're just, it's not easy.
Yeah, I see like a sandbox where you like can help that education with the medication reconciliation, as if there's like almost not a pharmacist on hand, the discharge plan. I mean, there's just the hospitals, there's just so many drop-offs. You don't know who to call, So
100%. I've done a lot of work
where
in the
where
I can tell you.
where
Yep.
were you guys? What kind of conferences for 2020? I'm sorry to
Yeah.
put you on the spot,
Oh
but like,
no, I've already got them planned, so that's fine. So we'll definitely be at Vive. Typically, we don't have a booth, but we do a lot of. We have like a little meeting area, and we do that. And then HIMSS, we'll have a big presence at HIMSS. And then, of course, we do the Epic user group meeting. So we spend a lot of time with our Epic partners there. And I'm sure there'll be some others that pop up along the way. We're doing some specific things with different vendors around healthcare to healthcare and just having conversations with CIOs and things like other executives in the organizations because it's a journey, it's a partnership. You've really got to kind of lean in and work together to make sure that we can transform this stuff, because it's, again, not just about, let me make sure I have the right technical requirements. You've got to make sure that you have a partner who understands your organization and can really help guide and work with you around how do we change those processes, because that's a big deal. You can't just drop in technology and expect it to fix everything.
Yeah. No, you're absolutely right. I love the user group Epic. When is that? Where and when?
So that is in August in Verona, Wisconsin on the Epic campus.
Okay.
Which is
that sounds,
if you've never gone, it's really,
yeah. No, I have not, but that sounds really, when I hear about you as an organization, I'm sure, you guys Talkdesk are very much immersed in the same thing on the finance, the retail. And if there's one thing in healthcare, I mean, Epic is to really, that is the source of truth at this point, the EMR, and they are the owner. I mean, they're the landscape. They're the, so I think that, to me, like, when you're all about, as you shared with me, about integrating with that care team, then that's the source of truth. And the fact that you're in there, then I'm imagining each year you're trying to roll out with those, whether it be the life science or the payer or that health system. How can you have that really user group, or that really satisfying that customer and really bolt down that relation? That's where that's happening, at that user groups in Epic.
Yeah. And we work with Cerner, and we work with Athena, we work with other EHRs as well. Because those are, not everybody has Epic. So being able to integrate with those EHRs is really crucial. So, it's not the easiest, that not every EHR is made for doing all of these different aspects, because they don't necessarily have sort of that relationship management aspect to them. So we do have some things that we have within our system to help with that as well. But yeah, the EHR piece is super important. It just, if you don't have that integration, it's going to be very difficult for you to do the transformation work that you want to do.
What do you think is really stopping healthcare from seeing like healthcare that we want as a consumer right now? What are I mean, I'm not talking, I don't want to go way out there for something, but just that can be like solvable in 2025 that you would think that.
Well, I think that, again, I talked about how core central tenet is clinical care versus consumer experience. So that needs to shift a little bit to, okay, what are the things that we can do in order to make this happen? So how do we start? First of all, I would say the key to getting ahead is getting started. And a lot of times we let sort of the overwhelming largeness of a project stop us from even getting started. So I think continuously improving, it's a journey. It's not a destination. Hopefully we will continue to always be evolving and making the experience better and better and better. And that's an important, I think, mindset to have, because a lot of times what I'll see is you set it and forget it, right? You kind of set it up and you're like, okay, we're done. And now I'm out. You got to, in order to do this right, you got to continuously relook at things and figure out how to make it better. What are the better processes? How do we sit down with our stakeholders and say, okay, here's where we are now. What are our goals for the next year? And how do we start working through those and having project teams that can do that? Now, of course, we know margins are shrinking. They're not growing in healthcare. So that's a big piece of this, is just the money piece is important. So these things have to have a return on investment for organizations.
I'm thinking as you were talking, you're satisfying within healthcare. You mentioned obviously payers, life science, and health systems. What do you think if there was one centralized thing in 2025 that you feel like you could add with your organization, Talkdesk, to making, like, where is there alignment with all three right now in the window of 2025?
It's a really good question, and I the more I work with my partners, customers, they really are streamlining, and a lot of that is the personalization aspect of things,
Mm-hmm.
right? That is, I mean, think about calling any of those. You're not typically feeling very well known or understood, et cetera. So it's a journey they all want to take, and they all want to give a better experience to either their members or the patients or whatever. That's all central. So being able to help people be known if they've called in before, and if they have, like, how do we get your information so that we can make you feel and understand what's happening for you? So I think that's, for me, especially in 2025, we can do a lot better with that. That's probably like, the layup where the technology's there today. There's no barriers. We're not waiting for a large language model to get better to help people feel known and more personalized. We can do all of that stuff today, and then we'll get better and better as we move forward.
So Patty, I feel like we've created the topic for this show. It's really like, it's empathy. Like, we are at Talkdesk leveraging like knowns with all our clients, which are the payer, provider, health systems. Empathy, like, call up, common sense. Yes, Mr. Man. Yes, Michael. Oh yeah, you like to be called M&M, not Mike. I mean, we know your nickname. We know what you eat. We know you like M&Ms. Great. We know you as a person, and we're going to help you. And we're not going to say we can't do that because of HIPAA. We're sorry, we can't help you. That's not our department.
Right. Because we can authenticate you. So that way, once you get past that barrier, which there should be, it has to be, right? But once you get past that, why not?
Yeah. So I love this. I mean, that's really, like, come on, it's common sense, help the people, and we can do that. And we can be the most trusted, I mean, I hate to, entity within healthcare. I mean, an agent that gets the job done. Maybe that's what, healthcare is worried about, that the call center will be the trusted agent. And, I mean, I hate to say it. I mean,
I would love to have that champagne problem.
Yeah. I think that's the biggest rough is that the payers obviously are the least trusted, the health system. There was a time, and, really they should say, well, we really need you guys because we need to up our game because, what else should we do as we kind of come to the day? We're kind of finishing up. We got a few minutes. How do people want to find you? Tell me.
Well, you certainly can always come to my LinkedIn. I do post there quite a bit. And of course, talkdesk.com to find out more information about the company and the products there, regardless of the industry that you're in. And certainly you can always reach out to me on my email, patty.hayward@talkdesk.com.
Cool. Well, man, I really am glad you came on today. I've learned so much. I hope our audience would feel the same. I think they should. Been a really important conversation with AI, with call centers. I mean, I'm sorry, but everyone has call centers. Call centers is like, it's like,
not going away.
Huh? What?
They're not going away.
Yeah, exactly. And you're only making it better. So anyway, this has been awesome. I wish you the best 2025. So.
You too, Michael. Thanks for having me.
Until next time, friends, we'll do it until next time, and we will be sending off. All right, friends.